Hi, Design-a-thon participants. My name is Brittany Straub, and I am here virtually to present to you your problem. Now, I am an occupational therapist by background and have experienced this problem many times with individuals that I have worked with. The particular problem that we have today has to do with LVADs, or left ventricular assist devices. Now, this device is effectively a pump that is implanted near someone's heart to assist that heart in pumping blood to the rest of their body. This is used in cases of advanced heart failure, where either it is a bridge to transplant and the LVAD is designed to buy them that time until a heart becomes available, or it's used as destination therapy, meaning the person will live for the rest of their life with this LVAD. Now, the LVAD, there's a few risks that come with LVAD implantation, as I'm sure you can imagine, with one of the biggest risks being a higher incidence of having a stroke after implantation. If you imagine an individual with advanced heart failure, it's typically not a condition that happens over the course of a day or two. It happens over quite a while. Your body naturally kind of becomes accustomed to working with a certain amount of blood perfusion. Your body gets used to not having as much blood pumping through it. Then when we implant an LVAD, all of a sudden those blood vessels that have become weakened and more used to less blood flow are getting hit harder. And that does create anywhere from an 8 to a 20% risk or incidence of having a stroke. 8 to 20% of these patients have a stroke when we implant their LVAD. And that is exactly what happened in the case study that I'm bringing to you today. I worked with a patient named Mr. JS. He is a 62-year-old male who was implanted with a HeartMate 3 LVAD. This happened towards the end of 2023. And he arrived to us in rehab about 2 weeks after he had this implantation. Now, JS, as a result of his stroke, ended up with right-sided hemiparesis, meaning that his right hand, and kind of specific to this problem, his right hand became much weaker, and he began to have issues with his dexterity in it. Now, I want to talk to you a little bit about what an LVAD looks like and how it works, because that's really kind of important to this problem. The actual pump for an LVAD is implanted near a person's heart, and then it is connected to a controller via a drive line. Now, all of these are training LVADs, but that's what this spot right here is for. This is our insertion spot for where that drive line goes. If you imagine one of these wires, it's always white. It's a little bit thicker than these ones, and it typically exits a human being's body right underneath the left side of their ribs and connects into this controller. The controller itself does control that pump. It tells it how fast to spin, all of those different things, but it also assists with providing the power source to that pump. The controller and the pump are both provided with power via the wall or batteries through these two wires. So an individual can connect these to some other wires that go to their wall, or they can connect them to an LVAD battery. Now, in order to make this connection, JS has to do a few different things. The first, let's see if I can make you guys see this, is these LVADs have two little half moon connections on the inside that have to be appropriately nestled together. So that's the first step, is I have to make sure that they're connected correctly. The next step, and really kind of the impetus for this problem, is they have to twist this. And they have to be able to twist it till it doesn't twist anymore. So you can imagine having less dexterity in this hand, trying to do that twisting motion can be challenging. And it is for a lot of these patients. Heart failure generally comes along with some debility. We are not talking about a population of very, very strong individuals. And so if somebody over tightens this, if somebody doesn't have the ability to pinch hard, if somebody can't make that grasp, you can imagine how doing this connection can be very challenging. And when we're talking about quality of life, it's extremely limiting. These LVAD batteries, they have a battery life of about 8 to 12 hours. So every 8 hours, the individual has to change their batteries. The other thing is being able to switch from wall power to battery power. When a person's on wall power, they need to effectively be stationary. They can't move around very much at all. The wall-powered cord is, I'd say 6 feet, but that's, I think, probably being generous. These batteries are really what's going to give them the most ability to move. And generally, someone has their controller and both of their LVAD batteries in a bag or in a holster to kind of move around with them. Now, if an individual cannot change their batteries, they effectively can't be left alone. Apologies. They effectively can't be left alone. And in our problem, JS really wanted the ability to be alone for longer periods of time. In this particular case study, his wife was planning a trip to the beach. She did that very frequently on the weekends. JS didn't like the beach, so he didn't want to have to go. And so whenever I started working with him in rehab, one of his biggest things from a quality of life standpoint, his other needs aside, were specifically with the LVAD. I need to be able to do this by myself. But JS didn't have the grip here. He didn't have the strength. He could rotate his arm, but especially if someone got this too tight, he had no chance of getting it. So from a problem standpoint, what we're really looking for is how can we make that twisting motion something more accessible to him? Now, there's a few different kind of limitations that I want y'all to be aware of. The first is that driveline length. This controller cannot go further than about 2 feet away from that human's body. So doing something like putting the battery between your legs would be possible. Putting the battery on across the table from you, it's not possible. It can't go further than this wire plus 2 feet. The other thing about this is a medical device. So there are only so many things that we can change about it before interfering with its function. And we don't want to do that. If this doesn't work, if the batteries don't work, the controller doesn't work. If the controller doesn't work, the pump doesn't work. And if the pump doesn't work, we're talking about a medical emergency. So from a general safety standpoint, we cannot add permanent things to this device. So in the past, I have wanted to add maybe a little extra textured grip right here. I can't do that because if I attach something permanently to here, it could impact its ability to be used. I also cannot restrict airflow. So I cannot put this in a plastic bag, for instance, and leave it in there for a long period of time. And then lastly, like I already mentioned, really be careful about that driveline length. Now, my hope for this design-a-thon is that y'all will be able to come up with some sort of idea of an assistive device that we can use to help JS unattach. There we go. And reattach that twisting line. Thank you all so much for being part of this. I am very excited to see what you guys come up with. I hope you have fun.